All right, I'm going to get started. Tonight's webinar is going to be talking all about the exciting things that we're doing in our practice. First, I just wanted to say hello to everyone. My name is Dr. Mark Adelsheimer. I'm at Regenexx Pittsburgh, and I'm going to share my screen with everyone where I have a slide presentation, and we're going to go through that. That should take about 30 minutes or so. And then afterwards, I will stay on the webinar and answer any questions that anybody might have. So I'm going to go ahead and share my screen. This is Dr. Mark Adelsheimer. I'm part of Regenexx Pittsburgh. Regenexx is a trusted alternative to orthopedic surgery. First, to introduce myself, I did my Bachelor of Science degree at Duke University. I then did my medical training at the Medical College of Pennsylvania in Philadelphia. I did my residency at the Tufts University in Boston in physical medicine and rehabilitation. And then I moved to Pittsburgh in 1996 and joined Dr. Lieber. And in my spare time, I like to play a little golf. This is us at Regenexx Pittsburgh. There's three physicians, myself, Dr. Lieber, and Dr. Sally. All three of us are board certified in physical medicine and rehabilitation with advanced training in sports medicine and pain medicine. Our main location is in Fox Chapel. It's what we call our Pittsburgh location. And we also have a satellite office in McMurray, Pennsylvania. So why is everybody here tonight? Why did you log on to this webinar? Maybe you're in pain. Maybe you are looking to avoid downtime, to avoid surgery. You've been told you're not a surgical candidate. You're looking for options. You don't want to rely on medications. You don't want to have to learn to live with this. You're not ready to slow down. You want more from your life. Basically, the main reason why you're here is to help improve the quality of your life so you can do the things that you want to do, whether that means playing sports or spending time with your children or grandchildren or just being more active and enjoying your life. So this is an overview of tonight's agenda. I'm first going to talk about Regenexx, which is our practice and what we're part of, what the different options are. I'm going to talk about interventional orthopedics, which is what we practice at Regenexx. I'm going to talk a little bit about the differences that Regenexx has to offer and who is this for, and also some results. So Regenexx is where orthopedic stem cell injections were invented. It was founded in 2005, and it was the first clinic on earth to begin treating orthopedic conditions using precise stem cell injections. It's a national group of providers. There are 75 to date. Of note, Regenexx Pittsburgh was one of the original 8 providers outside of Colorado where Regenexx was founded. Every Regenexx physician is a qualified doctor. They're all an MD or a DO, and they're all trained the same way to perform high quality procedures. And that's what I'm going to be talking about, are the procedures that we perform, whether that be prolotherapy, PRP, or stem cell injections. So Regenexx has been doing this since 2005, and here in Pittsburgh, we started in 2012. So we're now entering our 12th year of doing orthobiologics right here in the Pittsburgh area. And our goal is to avoid more invasive surgery. As I mentioned, meniscus surgery is just one example of surgeries that are not indicated because they lead to further problems. So this is where we were. Sorry about the snafu for the beginning of the presentation. So in 2000, most orthopedic conditions were treated surgically. By 2015, this had changed a little bit, but this is where we're heading. In the future, approximately 67% of conditions that were treated surgically in 2000 will be able to be treated with orthobiologics. And that is what we are doing now, and we have been doing since 2012. So we represent a new medical specialty of interventional orthopedics. As biologics and delivery devices improves, orthobiologics' goal is to avoid the more invasive surgeries. So we use equipment. This is a picture of the equipment that we're using. There's an ultrasound machine here on the right and a fluoroscopy machine. The reason why we use this equipment is to accurately place our cells. I'm going to talk more about that when I go into further depth into our discussion tonight. I do have, again, some examples of what I mean. Here's a picture of a needle injecting into a shoulder joint. You can see this is dye going down into the shoulder joint. You can't actually predict that you're going to be correctly in a shoulder joint unless you do this correctly. This is another picture under X-ray of a needle going into a bone and some more needle going into the joint. So we use X-ray and ultrasound to make sure all of our needles are in the exact location. At Regenexx, we do basically two different types of treatment. One is using platelets, also known as platelet-rich plasma, and the second is using bone marrow concentrate, which contains your own stem cells. Platelets are found in your blood. They're the healing cells that are in the blood. They contain a healing growth factor. They help to speed up and help to repair tissues. They contain serotonin, which is a substance that helps to calm down pain. And very importantly, they attract stem cells. By attracting stem cells, this helps to facilitate the healing process. So there's two different ways that we use platelets in our practice. Let me go back. The first is PRP, or platelet-rich plasma. Generally, we're using the platelet-rich plasma when we're treating more mild conditions, such as tendon problems, ligament problems, or more mild joint problems. PRP, or platelet-rich plasma, has become very mainstream, especially in the sports medicine community. Most athletes, whether they be professional athletes, collegiate, high school athletes, or even weekend warriors that have injuries are all now getting PRP to help facilitate the healing of their injury. A good example in Pittsburgh was TJ Watt. When he injured his pectoral muscle, instead of having surgery, he had PRP injected, and he was able to get back onto the field within 3 to 4 weeks. Platelet lysate is also using platelets, and we use that when we're treating nerve conditions, especially in the spine when we're doing our epidural injections. And we also use it when we're treating nerve entrapment, such as carpal tunnel syndrome or an entrapped nerve anywhere else in the body. The reason why we use the platelet lysate is the growth factors are immediately available, so they help to heal more quickly. This is a really important picture because it shows a difference between the Regenexx PRP on the right and the type of PRP that you'll get at your orthopedic surgeon's office on the left. The difference is theirs is bloody, ours is not, because theirs contains red blood cells because their processor isn't nearly as sophisticated as ours. So if you were going to go to an orthopedic surgeon office and get a PRP treatment, you are going to get an inferior product than the same exact treatment that you would get at our office. In addition, you're also going to be getting it from a clinician that isn't trained in how to deliver these type of cells. So the other cell that we use is an adult stem cell. These come from your own body. An adult stem cell is an undifferentiated cell that's held in reserve until it's needed to help orchestrate a repair response. The nice part about using stem cells is they can turn into many different types of cell types. So they can orchestrate many different responses. So if you take the same cell and put it into bone, it can orchestrate a bony response. Whereas you put it into an area where it's lacking cartilage, it can help to heal the cartilage. The same is true with a ligament or a tendon. So a mesenchymal stem cell, which can differentiate into orthopedic cells, can help orchestrate a repair response where it's placed. They self-renew. So if you use somebody's stem cells, you don't have to worry about the fact that they're not going to have any more stem cells. Your body will replenish all of the stem cells that we take out of you within 6 weeks. They also help to provide new blood supply where they're placed. So I was going to walk everybody through what's happening during a stem cell procedure. Sorry, let's go backwards. The stem cell procedure is a 3-step process. The first step is the pre-injection, and that's done with prolotherapy. It helps to stimulate the inflammatory response and is done a few days before the stem cell injection. The second step is the bone marrow concentrate, and this is where I have a video showing me extracting bone marrow from one of our patients. This is where we get the stem cells. And the reason why I think it's nice to show this is because you can see how easy this process is, because when I describe it to people, it's often the part of the procedure that they're most concerned about. So I'm going to hit this video, and you can see how easy it is. I'm using this under ultrasound. I'm watching my needle to make sure it's up against the bone. I'm watching on the screen in front of you, and I'm getting it down onto the bone, making sure it's in the correct location. And once I feel that I'm exactly in the exact location, I use a small little drill to advance the needle. It goes into the bone. All I have to do then is pull out the stylet, which is the inner part of the needle. We put a little drop of heparin in there first, and then we use a bigger syringe to extract the bone marrow. And you can see how easily it comes out. It looks like blood because it mostly is the same cells that are in blood. However, this bone marrow concentrate is rich with billions of stem cells. And these are the cells that we use to help heal the conditions that we're treating. Then I just put the stylet back in, pull the needle out, and we move on. So that's the second step of a stem cell procedure. That's the extraction. And again, what we're doing here is planting the seed, or we're planting the stem cells. It's once we take that bone marrow, we take it to our lab and we process it. In the lab, from that big syringe of bone marrow that we get, we actually only use about 5 to 10% of that, which are the pure concentrated stem cells. So when a patient comes in, they will get the bone marrow concentrate done. We'll take that bone marrow to the lab. It takes them about 2 hours to process it. And then we bring you back, and under X-ray and or ultrasound guidance, we will re-inject your stem cells directly into the area that we are treating. The third step of a stem cell procedure is done with PRP, and that's usually 2 to 4 days after the stem cell injection. On that day, we will do a blood draw. We will take your blood to the lab. We will process it, and then we re-inject the blood, the platelets into the joint that we're treating, because this acts like a fertilizer. So the 3 steps to a stem cell procedure, the analogy is tilling the soil with the initial injection, which is done with prolotherapy, planting the seeds, which is done with the bone marrow concentrate containing your own stem cells, and then the PRP, which is fertilizing the seeds. So just like when you plant seeds in your garden, you don't have flowers the next day. This does take some time for the effect of this to take place. So it takes about a month before our patients start feeling better, and really about 3 months before they feel a lot better. So before we get into the indications of bone marrow concentrate, stem cell procedures, and or platelets, the first question we always have to ask is this safe? And the answer to that is absolutely safe. We have never had an infection. We have never had any complication. When you compare this to surgery, all of these things are possible, because surgery is done with knives. It's done with scalpels. It is done with retractors and cameras. It's done in hospitals where a lot of infections take place. It significantly increases the risk for things like nerve damage, blood clots, infection, and can even cause heart attacks and death. Whereas with our procedures, we have never had any significant complication. It is very safe. This is a needle procedure, all done in our office. And again, I always, emphasize safety. The first rule of medicine is do no harm, and we have never done any harm with these procedures. So let's talk about what areas of the body our procedures are for. And I'm going to just kind of hit the main 4 areas. However, we treat all orthopedic conditions in the body, meaning beginning in the neck, going all the way down to the toes and everywhere in between. But the big 4 players that we see most often are knees, shoulders, hips, and spine. So let's start with the knee. The reason why I like talking about that first is because even when you have bone-on-bone, end-stage, I need a knee replacement arthritis, you can come to our practice and get a stem cell procedure and expect to have at least a 66% improvement. This is a game-changing treatment for our patients. We also treat meniscal tears, and we also treat ACL tears. And again, we can help to heal these problems so they do not necessitate surgery. This is a case study of one of our patients. This is Pam. She's a 58-year-old aerobics instructor who had 4 years of severe knee pain. She had grade 4 chondrosis, or end-stage osteoarthritis, bone on bone. Grade 4 is the worst you can get. Her pain was a 6 to 8 out of 10. She was not able to teach aerobics. She wasn't living her life. She wasn't working. She underwent a stem cell procedure with us, and 3 months later, her pain had reduced to a 1 out of 10. She was back to doing aerobics, yoga, Pilates, plyometrics, and she felt 85 to 90% better. This is a picture of someone who had a torn ACL who was treated. This is an ACL tear where my arrow is pointing right on my screen. And this is after we placed stem cells into it. And you can appreciate the fact that the ACL now is repaired. It is now a deep, dark line where it was here a complete tear. You can't see any ACL inside this. All you can see is the sheath or the gray structure around it. Moving on to the shoulder. The main conditions that we treat in the shoulder are rotator cuff tears, labral tears, tendonitis, and osteoarthritis. Again, we will decide when you come to see us whether or not you would need PRP or stem cells to help treat these conditions. But these are all very common shoulder problems, all of which are very treatable in our practice. This is a MRI study of someone with a torn rotator cuff. The arrow is pointing at the rotator cuff tear, both pre and post stem cell treatment. And after the stem cell treatment, you can see that all the inflammation is gone and the rotator cuff is no longer torn. The hip is the 3rd most common joint that we treat. Hips are a little bit more difficult than knees in the fact that patients that do have end-stage arthritis of the hip are no longer candidates for regenerative treatment. So if you have severe osteoarthritis and you're over 55 years old, the chance of having a good outcome with stem cells in the hip is much less than the knee. However, people that have moderate arthritis or have severe arthritis at a younger age can have a very good outcome with treatment of the hip. So we do treat a lot of hips. We just have to be a little bit more careful when evaluating hips because we know if it's end-stage arthritis, the outcomes may not be as good. We also treat a condition known as avascular necrosis. And when we're treating avascular necrosis, we're actually drilling into the bone and placing stem cells directly into the bone. So again, the hip outcomes are very, very positive. Most of our patients have returned to active sporting activities. This is a picture of a needle going into the bone, treating arthritis. So this needle has a hollow core, and we place, this is where the avascular necrosis is, right up here, and we will place the stem cells directly into the bone itself. In addition, we place it into the joint when we're doing this procedure. So the fourth and other very common area that we treat in our practice is the spine. And it's not just the lower back, it's the thoracic and neck area as well. So we can treat basically all spinal conditions, whether that be sciatica, painful or herniated disc, facet joint pain, sacroiliac pain, ligamentous pain, spinal stenosis, or post-laminectomy, which means after people have had surgery. So even people that have had surgery can still come to see us and can still be a good candidate for treatment of their spinal conditions. This is a picture of a needle going into the epidural space. So instead of putting steroids in the epidural space, we put platelet lysate into the epidural space because it creates a significantly better long-term healing response than doing an epidural steroid injection. This is a slide showing the difference. At 3 months, epidural steroid injections have pretty much gone away, and by 6 months, there is basically no residual effect from an epidural steroid injection, whereas a epidural platelet injection, patients still have significant improvement and significant benefit in their quality of life, whether that means walking, sitting, lifting, bending. So again, a significant better long-term outcome using platelets as opposed to steroids, especially in the spine. So what's important when it comes to doing these type of procedures? Physician expertise matters. It's really important that you go and see physicians that know what they're doing. At Regenexx Pittsburgh, we've completed over 3,000 stem cell procedures and more than 12,000 platelet procedures since 2012. At Regenexx Pittsburgh, we're all experts holding board certification in physical medicine, rehabilitation, pain, and sports medicine. If you come to our practice, you're going to get a physician who's focused on your care. You're not going to get a physician extender like a physician assistant. You're not going to be seeing a nurse practitioner. You're not going to be seeing a chiropractor or a naturopath. We will spend time with you. We will examine you correctly. The other thing that really matters is that we all have expertise in how we place our needles. This is something that we have advanced training for. Dr. Lieber, Dr. Sally, and myself have spent countless hours out at Regenexx and at various courses through the country becoming experts in fluoroscopically guided procedures and in ultrasound guided procedures, and this matters. If you go to an orthopedic surgeon's office and get a PRP injection, they have never been trained in accurately how to do this procedure. And as I mentioned earlier, you're also getting an inferior product because they don't have the same technology. So what doesn't matter when it comes to having these procedures done? Age doesn't matter. We have done a 98-year-old gentleman in our practice. Your stem cells continue to replicate your entire life. We have done several patients in their 80s and a few in their 90s. And age is not a factor when it comes to undergoing treatment with us. Obesity doesn't matter either. A lot of patients will go to an orthopedic surgeon and they will tell them, you need to lose weight before you can get your hip replacement or your knee replacement. However, we have done, people with high weight multiple times who have had excellent outcomes. A lot of the reasons why people can't lose weight is because they have a bad knee. Well, we make their knee better, and then they can engage in an active exercise program. And as a result of that, they can lose the weight that they've been trying to lose for years. So weight by itself is not a factor. And as I mentioned, even people with end-stage bone-on-bone, this is an x-ray of someone with end-stage bone-on-bone arthritis of the knee, with osteophytes, with significant joint space narrowing, can be treated in our practice and expect to have a significantly good outcome, especially when we're talking about the knees. As I mentioned, it's not true with the hips, but with the knees, it is 100% true. 87% of the people who were told that they needed a knee replacement and had a procedure in our practice never underwent that knee replacement after having our procedure. So it can make a significant difference. So which one is for you? Basically, in our practice, about 80% of what we do is with platelets and 20% is with stem cells. So the platelet procedures are done for the more mild problems, such as ligamentous laxity, tendon problems like rotator cuff tendonitis, Achilles tendonitis, golfer's elbow, tennis elbow. These things are slam dunk treatments with PRP. Plantar fasciitis, and spinal conditions. As I mentioned earlier, we use primarily platelets when we're treating spines because it is so effective. So whether that's facet arthritis, spinal stenosis, sciatica, PRP can make a significant difference in the spine. The bone marrow concentrate or the stem cell procedures are when there's more damage, such as knee arthritis, hip arthritis, shoulder arthritis, ankle, wrist, elbow arthritis, or if we're dealing with something like an ACL tear or a complete rotator cuff tear. These are all things that can be treated with bone marrow concentrate containing your own stem cells. So what's the downside, or what is the financial information that I wish to declare? These procedures, for the most part, are not covered by health insurance. However, your consultation in our office is 100% covered by health insurance. So I highly recommend that people come to see us, and we will give you an honest opinion as to whether or not we can help you. And then you can make a decision. So coming to see us in our practice, we take basically every health insurance that is out there in the Pittsburgh area. If we need to order any diagnostic testing or a follow-up visit, that's all covered just as if you were to see any other doctor. Again, the regenerative procedures, which means the actual PRP or stem cell procedures, are not covered by health insurance, and we will let you know exactly what it would cost if you were to have this procedure. But keep in mind that our procedures have a significant cost savings. And when you compare the cost of what it is to go into the hospital and have copays, deductibles, lost time from work, physical therapy for months afterwards, every time you go, the costs actually, when you analyze it to, are often quite more to undergo surgery as opposed to having a regenerative procedure. So in conclusion, Regenexx isn't magic pixie dust. It's advanced, precise, safe interventional orthopedics. Regenexx has been doing this longer than anyone else in the United States. Regenexx has more treatment options available. Regenexx is also published, and we have an online registry data. And this is really important. So every patient that has a Regenexx procedure with us gets registered in a database, which now has about 125,000 patients in it, including every patient that we've done in Pittsburgh. So this way we're able to use this information to make new progressive decisions. And we use this information to change how we continue to deliver the top-notch, cutting-edge, high-quality procedures that we do. So Regenexx avoids surgery, reduce downtime, most importantly, get your life back. So how do I get started? Very simple. Schedule a consultation with one of the Regenexx physicians. You come to see myself, Dr. Lieber, or Dr. Sally. All you have to do is call our office. My next slide has that number. If you have an MRI, bring it with you. If you don't worry about it. If we feel you need it, we'll order it. If we don't feel you need it, we won't order it. What we do promise you is that we will give you a comprehensive evaluation which will include a history, physical examination, most likely an ultrasound examination, depending on what we're examining, and we will give you our honest opinion as to what we can do to help you. Maybe it'll be a PRP or stem cell procedure. Maybe it won't. Maybe we'll just say to you, hey, you can treat this with physical therapy. You don't need to have this procedure. Or maybe we'll say you need to see a surgeon. However, we will give you that honest opinion when you come to see us. So the next step is just to contact Sarah Furlan. She is and schedule an in-house, or we can even do a video consultation. Our number is 412-963-6480, and just schedule an examination, and we will be happy to give you our honest opinion as to whether or not any of our procedures would help you. We can guide you through how the procedure would go and what kind of benefits you would expect from the procedure. So I want to thank everyone for joining me tonight, and I'm going to open everything up to questions now. So I'm going to end the slideshow, and hopefully we'll have a nice question and answer session so I can answer everyone's questions here. All right. Sorry again for the snafu at the beginning of the procedure. Okay, first question. How do you control pain during the extraction and the injections? Well, that's a very good question. First of all, to answer that, to put your mind at ease, it is not a very painful procedure. I say that because I've done well over 1,000 of these myself. I've witnessed everybody's action and response to it. The first and foremost thing that we do is we numb everything up. So what you will feel is a pinch and burn from numbing of the skin. You will feel, then we move the needle down to the bone. You may feel a little bit of numbing when, you may feel a little bit of numbing when we're numbing the bone, but once that bone is numb, you do not feel the needle going into the bone. We also have laughing gas in our office, which is Pronox. And that's available to use. Most of our patients like it. It kind of makes you kind of giddy. You don't even know what's going on. And it's, again, something that we offer. So again, this is I'm not saying it's a pain-free experience, but, it is relatively painless. And with the laughing gas, it is, close to being pain-free. Next question, I have bone-on-bone pain in both knees. Can you do both knees at the same time? Excellent question. And the answer to that question is no. And the reason the answer is no is because when we do that bone marrow extract and we take out a certain number of stem cells, we don't want to put half of those in one knee and half of those in the other knee. If we did, each knee is only getting a half a treatment, and that's not what we're looking for. As I mentioned earlier, your body will regenerate all of the stem cells that we take out within 6 weeks. So we usually choose the more involved knee first. We'll treat that. You'll go to physical therapy afterwards for a while, start some rehab, get strong there. And usually it's about 3 to 6 months later that we'll treat the other knee. So, we don't want to do both knees at one time because you can't safely get enough stem cells to adequately treat 2 knees at the same time. We will, however, do a knee and a small extra joint like a toe. A lot of people have arthritis of their big toe, or maybe the CMC joint, which is right here. Most common joint to have arthritis in the thumb. So often we will do a small joint along with a bigger joint, but we don't want to do 2 large joints at the same time. Okay, next question. With bone-on-bone knee arthritis, do the procedures simply eliminate inflammation, or is it possible to actually regenerate cartilage? Excellent question. So what do these stem cells actually do to the knee? Are you actually regrowing the cartilage? That question is asked to me every time I do this procedure. And the answer is a little bit. You're regrowing a little bit of cartilage, not all of the cartilage you were born with. So if I did an MRI on you before and afterwards, and I had that example, you saw that that one patient went from a grade 4 to a grade 3 chondrosis. They didn't go to a grade 1 or a 0. However, the main thing that stem cells do for the joint is they make the joint a healthier environment. So they're changing the biochemistry of a joint. An arthritic joint, if you were to stick a needle in it and take that fluid and send it to the lab, it's going to show a lot of toxic enzymes that are degrading away at the joint. However, afterwards, if you can flip that by putting about 1 billion or so stem cells in there, it makes that joint healthy. A healthy joint is strong. It responds very well to everything that you're having done. So it can really have a significant improvement in the functionality of the joint, even if it hasn't regrown all of the cartilage. It will regrow a little bit of it, but it actually makes that joint healthier and stronger. Next question. PRP can help with ligamentous laxity. Someone told me what happens if they scar the nerve around it as a side effect. The nerve scars in with connective tissue around. Is that a downside? That's absolutely a possible downside, and that is why we do every injection guided with expertise. I am making sure that my needle is in the exact location where it needs to be. If you go to an orthopedic surgeon's office and they just shove it into your knee, they can certainly cause problems. They can hit a nerve and can cause scarring. I can be 100% sure because I'm watching my needle the entire time that I am not touching a nerve. Again, we have done 15,000 procedures and have never had a complication like that because we do it correctly. So what you're saying is entirely correct, but it's not a problem with our practice because we have the expertise and we make sure we do it that correct way every time we're doing these procedures. Lori asks, I had a PCL replacement meniscus surgery 10 months ago, and the surgeon is wanting to do another surgery to remove more non-functioning meniscus. Is there such a thing as non-functioning meniscus, and would I get any benefits now from Regenexx after the fact? So if the PCL replacement surgery, and if you had, keep in mind when they're doing meniscus surgery, they are removing parts of the meniscus. It is a bad, leading to bad outcomes. So if the surgeon is now recommending another surgery to remove the non-functioning meniscus, that is a big mistake. I absolutely wouldn't do that surgery. The meniscus, the purpose of the meniscus is to provide shock absorption to the knee. You don't want to remove any of that meniscus. You should come to our practice. We have significant ways of helping to restore your knee before you undergo that second surgery. It's okay that you had the first surgery. A lot of our patients have had prior surgery before they have treatment with us. But before you get more surgery done, you should absolutely come to see us because this is it's not indicated, especially when you're talking about removing part of the meniscus. Next patient asks, can you give a ballpark dollar amount for the cost of your procedure? A rough estimate is fine. These procedures can be anywhere, from $1,000 up to $10,000 and everywhere in between. So it's very hard for me to, say, again, most of our procedures are on the lower end because most of what we're doing is PRP. The $10,000 procedures are when we're doing a very extensive stem cell procedure with multiple other areas involved. So again, you would have to come in. It's really hard to give an actual estimate depending on what conditions that we were treating. But most of these are not anywhere near, that high number. Next question, follow-up. If the PRP helping ligamentous laxity, you mentioned the importance of guidance, but if in the spine, yeah. So in the spine, absolutely, fluoroscopy ensures it's totally safe. You can see the nerves. Yes, you can see the nerves with fluoroscopy because before we inject where the nerves are, we inject a little bit of dye to make sure we're not near those nerves, unless we want to be near the nerves. If you're in the epidural space, you actually want to treat the nerves. So fluoroscopy is incredibly important when you're doing spinal procedures, so you can make sure that you are in the correct location. There are very few physicians that are trained in fluoroscopically guided procedures correctly. It is something that I have been doing for 30 years in my practice, as has Dr. Lieber. Dr. Sally has been with us for 9 years, and he's been doing these ever since. So again, it makes a huge difference to have expertise in fluoroscopy if you're doing any spinal procedures. Next question. Would a bone marrow procedure do any good after a knee replacement? Unfortunately, no. Once your knee is replaced, there's nothing we can do. So I see people a lot who've had, one knee replaced, they're coming to see me for their other. The one thing to keep in mind is, our procedure isn't the end of the road. A knee replacement is the end of the road. So once you've had a knee replacement done, bone marrow procedures are not going to do anything to make it better. All you can do at that point is pain management. Bruce asks, how often do procedures need to be repeated? For a stem cell procedure, we've done very few repeats. We've been doing this for 12 years now. A few of our first patients are now starting to come, 10 to 11 years later, asking us if they, for a repeat procedure. So we know, and Regenexx has published this data, that people that got better at 6 months, 95% were still good at 5 years. They don't have enough data to publish 10-year data, but we feel that this is lasting at least 10 years for most people. And as far as the PRP treatments, most often we're healing the underlying problem, so you do not need to have this repeated. Certain conditions, you might need to have a repeat injection, and if it is, it would be, a year, 2 years later. But again, we tell our patients to look at this as being a one and done type of experience. All right, any more questions? Here comes another one. When you say it's safe, I don't know, what was that? Sorry. Is that just relative to surgery? Like, are there still risks? No, this is not just, I'm just saying surgery isn't nearly as safe as this. As far as safety is concerned, we have never had any significant complication. The most that we've ever had is some soreness around the injection site. So this is incredibly safe. All we're doing is taking some of your cells from one part of your body and moving them to another. Every needle we stick in you is guided, X-ray or ultrasound guided. It's done in a sterile environment. It is done by experts who know how to do this correctly. Again, I take great pride in our safety protocols. So again, this is an extremely safe procedure. And how far should someone go from minor ligament instability? Again, ligament instability is one of the main things that we treat in the spine. So PRP works great for that. I would definitely recommend coming to see us. Sabine asked me, if I understand you correctly, as a 68-year-old with severe arthritis in both hips, I'm not a candidate. I don't like to say that over, because what you consider severe may not be severe. I would still recommend coming in. We can take a look at it. If it's end stage bone on bone and you have significant range of motion loss, then you would not be a candidate. But again, that's best evaluated in the office. Rose asks, if I had bone on bone, would PRP alone help, or would you do stem cells as well? Most likely, if we're again, depending on what joint we're talking about, if it's a small joint like the thumb or toe, PRP often will work. But if we're talking bigger joints, knees, hips, shoulders, you want to do the bone marrow stem cells. It makes a big difference. Gary asked, said you previously did my left shoulder in 2015. I now have x-rays and ultrasound on both shoulders showing some tears. Again, that was 9 years ago. So we'll be happy to take a look and see what's going on now. Life goes on, so people ask, do you need to have a repeat procedure? hopefully the procedure you had in 2015 gave you a lot of benefit for a number of years, and we'll see where you are now and see if there's any other options that we can look to help you. Any other questions? They asked me about soreness at the injection site for side effects. No, it's just, when you stick needles in, sometimes it can hurt for a day or two afterwards because you are going through muscles. It's not, it's just a temporary problem. Okay. Last chance to ask any questions. Lori, I asked about surgery. My phone died. Let's see if I could find her earlier question. Yeah, I hope I saw your previous question about the surgery. And again, I would recommend coming to see us before you had a second surgery. From what I'm reading here, you said you already had one surgery, PCL replacement, and you're considering a second surgery to remove non-functioning meniscus. I would absolutely recommend that you do not have that surgery. So that's my recommendation, because if you do have more surgery, you're only going to increase your risk for developing more problems. All right. I hope I answered. Thank you, Lori. I see that you thanked me. And I, again, want to thank everybody for joining me tonight. This is being recorded so people can log on and hear all these questions later. Again, the best way to get your questions answered is just come and see us. We will give you our honest opinion. We will let you know exactly how we can help you. 412-963-6480, and hope everybody has a great day out there. I'm going to end the discussion now and sign off. Bye-bye.